Thank you very much for inviting me. I'm not a psychiatrist, but I'm a physiatrist. And you imagine how many times I've been introduced at conferences as a psychiatrist because of just a spelling mistake. I'm used to that, and I feel like a psychiatrist now. I'm very happy to be here among all of you, and I'll be talking about the ECHO project. And I have a video. I hope I don't have any commercial interests. I'll try to present, because a picture is 1,000 words, but a video is 1,000 pictures. So we are talking about 1 million words. So.
There is a specialist shortage worldwide. We had to innovate a new model. Project ECHO allows specialists like me to force multiply expertise. I think that's why it works, because it's very simple. And that's actually why I could come up with an idea like this, because it was simple. In 2003, there were 30,000 patients with hepatitis C in New Mexico. I didn't have enough time to see everybody. And that led to a lot of soul searching. What is the way that I can have a bigger impact than the patients whom I just see in my own clinic?
Well, the 1025 was 10.
It just came as an idea. Skype was available. I talked to my daughters on it. Seeing this technological revolution unfold was probably a background knowledge that I needed to come up with this idea. In 2010 alone, we have trained more than 1,000 healthcare clinicians on our video conferencing platforms. Nurses, primary care doctors, physician assistants. Uniformly, every single ECHO project that we've started, the specialists find it extraordinarily rewarding sharing their expertise to improve the health of underserved populations in the United States and ultimately all over the world.
So when I watched that video in 2013, I was converted immediately, and Dr. Aurora is my hero. I said, I need that in Ontario. How do I bring this to Ontario? A friend of mine, a family physician, pain specialist from Kingston, she showed me this and she said, Andrea, can we bring this to Ontario? I said, I need this desperately because my wait list, I'm a pain specialist at Toronto Rehab, was at that time 2 years. In many areas of Canada, the wait list to see a specialist is 3 years. And I said, well, I cannot see every single patient with chronic pain in Ontario, and my colleagues, we are overwhelmed. How do I train family practice? And how do I see patients in rural areas? So we went to the Ministry, Ruth Dubin, my co-chair, and myself, we went to the Ministry of Health, and we showed this video. And they said, yes, we'll fund you to do a demonstration project. So that's why I'm here today. And I'm happy to say that CAMH, Sanjeev, also got an ECHO recently. They're running their 4th ECHO session this week. What is the ECHO model? So you saw Dr. Aurora talking. We use telemedicine. We use so it started with Dr. Aurora in New Mexico because he's a hepatologist. We use Ontario Telemedicine Network. CAMH is using the same system that they use in the States, which is Zoom. I like better Zoom, but we are using OTN. It's, the ECHO model is to treat, you have to choose a condition that is complex, chronic, and common. So chronic pain is one of them. Mental health is another one. That's why the ministry funded CAMH to do. Because we want to reduce variation in the process of care. If the condition is not complex, you don't need an ECHO. Because it's simple. People just follow a guideline. But when things get complicated and confusing, you probably need an ECHO to share best practices. We use case-based learning. So how does ECHO work? I'll show you a few slides later. But we are available, an interprofessional team of experts is available 2 hours a week, every week. We sit there in this room and we wait for the community to present cases to us. And they present real cases, anonymous, we never see those patients, and we kind of co-manage those patients. And also we monitor outcomes. The O in ECHO is monitoring outcomes. So what a typical ECHO session is. So this person here in the middle is Dr. Ruth Dubin, the family physician who is my co-chair of ECHO Ontario. So this is a screen of Ontario Telemedicine Network. You may be familiar with this. There's a big screen here and 7 around. But that's just because we can only show 7 at each point. But there are probably many more. So this session we had 20 sites, and our echo spokes are here. And we, the experts, we are sitting both in Kingston and Toronto. So 2 hours. These community practitioners, family physicians, physician assistants, pharmacists, nurses, anyone can come and present a case to us. Sometimes we discuss 1 case, sometimes 2, sometimes we see 1 new case and 2 follow-ups, and we also do a short didactic that follows a curriculum. So our curriculum is here. If anyone wants to see, I have a brochure here. And this is the ECHO brochure if you want to see the ECHO model and give it to someone else. Or hub. So we use this hub and spoke model. Our hub is both in Toronto and Kingston, because we are a split hub with Ruth in Kingston and myself in Toronto, but we are very interprofessional. So this is the people sitting around the expert table. Myself, a physiatrist. There's a pain physician, an addiction medicine, neurology, family physician, psychiatry, psychology, nursing, occupational therapy, physiotherapy, pharmacy, chiropractor. We are the only ECHO in the world that we have a librarian sitting in our ECHO session, and then the admin people. Not everybody gives advice to every single case, but we have them available there when the need arises. Sometimes the case is more psychosocial, so our social worker and psychologist will be the ones talking more. Sometimes it's more addiction to opioids, and our addiction medicine expert will talk more. Since we started in June 2014, that's when we had our first session, then you have to go and recruit spokes. So what do you tell the spokes? You say, well, you're coming to attend this ECHO session, so you have to give us 2 hours every week for as many weeks as you want. You can stay for 1, for 2, for 5, but our curriculum follows 21 weeks, and we would like you to attend 21. So then you have all the didactics. I don't have time. 21 weeks? 2 hours every week? No, I don't have time. But we were able to, so far, we had already more than 100 practitioners that joined us. Every session we have around 20 sites. Some sites have only 1 solo practitioner, but sometimes it's the whole family health team in some rural area of Ontario that is connecting with us. So how does this work? We have a multidisciplinary interprofessional team here. And then we have all of these spokes who may be a solo physician sitting in their office using their PCVC in their laptop. Or you have the community health center, a family health team. It can be a nurse-led clinic. We had many areas of rural Ontario that's just a nurse-led clinic, or many other things. Then this person presents a case. Let's say one person from the family health team presents a case. And then we all discuss. But it's not just the experts providing advice to that case. We first open for the community. We ask our spokes, we say, what would you recommend to this person presenting the case? And you would be surprised that they know a lot. You just need to improve their competence and their confidence that they know and reinforce those things that they are recommending right. And then there is very little that we, the members of the hub, we need to say. So what we are creating is the concept of force multiplication. That's what Dr. Aurora wanted to do by training this professional. So here we are the ECHO Hub, and then let's say we have 4 spokes. But then later, these spokes are becoming little pockets of centers of excellence. And we have seen some groups, like in Marathon, Northern Ontario, they came together, they finished a cycle of ECHO, and they told us, we're not coming anymore because we are now providing consults for our colleagues around us. We have now a little pain team. That's so exciting because those patients didn't have access to experts in their area. ECHO model has been replicated for more than 20 conditions around the world. There are 6 countries replicating ECHO. Our ECHO pain was the first one in Canada, and Sanjeev is the second one in Canada. We are pioneers here. And, but there are echoes all over the world for rheumatology, diabetes, pediatric epilepsy, spinal cord injury, autism, you name it. There is a Meta Echo conference that we went last year that Dr. Aurora is bringing everyone around the world who do echo to talk to each other, to learn from ourselves what works, what doesn't work. So the goals of echo basically is to disseminate specialist knowledge to primary care. And I'll pause a little bit here. If you are a specialist in this room and I ask you, are you willing to share everything that you know? You spent years and years in residency, fellowship with primary care. You're going to tell them your secrets, because they will ask you at this session, Dr. Furlan, how do you do this? How do you tell the patient about this? And so you have to be open up. I found some of my colleagues, the specialists, that told me they don't want to do that because they spent years and years specializing. They don't want to share. So that's one thing. You have to find the right specialist to sit at the table to provide this kind of advice. You also don't want that super professor sitting at the echo table, and when someone presents a case, they will show their mistakes, and this professor says, I can't believe that you did that. What a stupid mistake. They will do that. So you need the right person to be sitting at this hub table, because you are mentoring, you're modeling, you're teaching, but most of all, you're creating this community of practice, and they will be little pockets of excellence like you are. So the ECHO goals: reduce unnecessary referrals. I don't want to see a referral to my clinic. Please see this patient, low back pain for 15 years. They never tried physiotherapy. They never tried paracetamol. So I say, that's not the best use of my time as a specialist. So you want to reduce unnecessary referrals. Carve the specialist demand, reduce wait times, improve the primary care providers. A lot of family physicians were thinking about leaving their area because they were burdened by these patients. And now they're thinking, wow, ECHO gives me some opportunity to debrief, to get some advice, to get some real-time consultations for my most difficult patients. I think I'm going to stay. And rapidly disseminate best practices through the province. That's all. Thank you very much.